On the backlog, the testing backlog now in terms of COVID-19. You can imagine being a healthcare worker and not getting your results back in time. It means you can't treat patients. Big problem in the Eastern Cape. Joan van Dijk from the Baker Cesar Centre for Health Journalism joins us now. Joan, good evening. Why are Eastern Cape health workers waiting so long for their test results?
Yeah, there are three reasons for that. Firstly, when health worker tests come to the National Health Laboratory Service, which is the government lab service, their tests are already pushed to the front of the queue so that they can make sure that those tests come back quickly. But even that smaller group is severely backed up at the moment. There are about 2,000 tests waiting to go through for health workers in the Eastern Cape. Secondly, there's broken equipment that's contributed to the backlog. There's also a lack of the chemicals that scientists are using to do the COVID-19 tests. South Africa also received fewer of the test kits than we were expecting. And that's because of international pressure on those supplies as well. And then the last reason is that the Eastern Cape might just be testing too many people. Health workers there are saying that in actual fact, they should be restricting who qualifies for a test in the first place.
Okay.
So you would only test people. Excuse me.
Okay, so I mean, there's clearly big problems there. I mean, the Western Cape, I think, if I remember correctly, changed its plan. Is its testing plan working?
It is working, but not for everyone. So if you're a patient in a hospital or you're a health worker, that plan is working really well and you're getting a result back within 1 or 2 days. But if you're someone who's healthy enough to be sent home to wait for your results, those are still taking ages to come back, and health workers in the Western Cape are saying that they're waiting up to 30 days for those. And they're saying there's no real use on doing those tests. It's kind of pointless because within 30 days you could have recovered.
Okay, what is being done to ease the backlog? It's a big national problem. What's being done to fix it?
At the moment, there's about 70,000 tests in the backlog. And to fix that, the National Health Laboratory Service is pushing to the front all the people who are at high risk and the health workers across the country. In the Eastern Cape, they're also sending equipment to the labs in PE and East London. And you can also send health worker tests to the private labs. In Gauteng, where the backlog's even bigger than in the Eastern Cape, the health department has appointed specifically a private lab just to do health worker tests.
Joan van Dijk.